Dear viewers, this presentation accompanies the article titled Transmigration of Canines and its Association with Malocclusions and Morphology, an analysis of 7 cases, and is brought to you by myself, the author Dr. Anup Halla, and my co-authors Dr. Sandeep Parasar and Dr. Mansoor Saifi from the Department of Orthodontics, KD Dental College and Hospital, Mathura. Transmigration of canine is the phenomena wherein the mandibular canine migrate below or labial to the mandibular incisors across the midline to either erupt ectopically or remain impacted within the body of the mandible. Recently, cases of maxillary canine transmigrations have also been reported. As per our study, the prevalence is around 0.19%, which is around 7 cases that has been compiled from a record of 3,500 cases from the past 7 years. Though the exact etiology of transmigrating canine is not clear, it is seen to be associated with cysts around the migrating canine, odontomas, supernumerary teeth, the absorbable mesial inclination of canine crowns, and a large symphyseal area that allows the canine to migrate through the cancellous portion of the mandible. Other features that have been associated with transmigrating canines include hypodontia, the presence of maxillary impacted canines, peg-shaped lateral incisors, which may indicate the possibility of a genetic cause for transmigrating canines. Also reported is the possibility of disturbances in the dental follicle, which results in an abnormal eruptive pathway, hence leading to an altered path of migration of the canine. Also, it has been noticed that pericoronal osteolytic areas are present, as has been noted in this study also, around the crowns of the transmigrating canine, and it is possible that this pericoronal osteolytic areas cause a dissolution of the bone around the crown, hence leading to the migration of the canine through this pathway. As an increased incidence of dental abnormalities has been reported in class 2 and class 3 malocclusions, the possibility of such an association has been investigated in the present study by analyzing certain craniofacial and dental parameters. It was observed that there was a predilection for dental class 2 malocclusion with deep bite, deep curvous P, and increased lower anterior facial height. There were also other abnormalities detected, such as retained teeth and pericoronal osteolytic areas around the transmigrating canines. The presence of other dental abnormalities indicate that the possible genetic background. As with the guidance theory, in case of maxillary canines, wherein the root of the lateral incisor guides the canines into place, it is plausible that the same effect may be observed in the case of the mandibular canines. The dental features observed in class 2 malocclusion, like deep bite, increased curvous P with supraeruption of the lower incisors, results in an increased space at the apical area of the lower incisors. This results in the crowns of the canine being related to the apical third rather than the usual middle third, hence resulting in a lack of guidance and probably deflection of the canines, which finally may follow an abnormal path through the cancellous portion of the mandible. As the present group of cases have been taken only from the records of orthodontic patients and the literatures do not cite the malocclusion consistently, no conclusive evidence between the malocclusion and transmigrating canines can be drawn. Though in this present group of cases there is a predilection for class 2 malocclusion, it is also possible that there may be an underlying genetic link because of the association of dental abnormalities along with class 2 malocclusions. Hence, the authors find it prudent to suggest reporting of malocclusions associated with transmigrations so that possible genetic associations between the type of malocclusion, the inherited anomalies, and transmigrations can be further investigated. In conclusion, the occurrence of transmigrating canines may be related to specific morphological patterns associated with dental malocclusions that result in increased space apical to the lower incisors, like crowding of the lower anteriors, supraeruption of the lower anteriors, increased curvous P, and deep bite, all such features that have been associated with the class 2, division 1 or division 2 type of malocclusions. Hence, a lack of guidance from the apices of the lower lateral incisors may act as predisposing factors in the occurrence of transmigrating canines. The authors would like to thank the viewers for their kind attention and interest in this article, and also thank the editorial board of the journal Orthodontics and the Art and Science of Dentofacial Enhancement for their interest and giving us this opportunity to present our cases. Thank you.